Hello, my name's Mary Page and I'm one of the memory nurses in the Leeds Memory Service, and I work in the part of the city covering the east side of the city. As a memory nurse, I'm part of the mental health team, but I sit in a portion called the memory services. The formal diagnosis within the memory services is going to be a dementia. If they haven't got a dementia, then they'll be discharged and they'll be just get on with the rest of their lives. And if they see any changes, it's back to the GP. But if our patients are diagnosed with a dementia, obviously there's lots of different types of dementias, but the common ones in my age group, over 65, is an Alzheimer's type dementia or an ischemic vascular dementia. And then if they're a candidate for any of the memory tablets, the doctors at that diagnostic appointment will have a conversation about commencing somebody on some memory tablets. And the doctors will titrate, which is get them onto the controlled dose. At that point, the doctors will check that there's no side effects. And again, there's lots of liaison work with the family, lots of liaison work with the patient. And once the patient is established on the medication, they're uncomplicated psychiatrically, which means there's no psychosis, there's no hallucinations, there's no anxiety states, there's no depression, there's no other psychiatric concerns. Yes, they've got a diagnosis of dementia, but they've still got a good quality of life, living in the community, have a support network around them, then they can be discharged back to the GP, or if on the medication, they come back to a nurse, and the nurse would then commence the monitoring, which is at present what I do. And we will go out and we will visit people in their own homes and have conversations about how they're adjusting to that diagnosis, what that diagnosis means to them, how the family are coping, because although the patient's been given the diagnosis, we live in families, so it's happening to everybody. Hello, Mrs. Henderson. Is it all right to come in?
Yes.
Thank you. Hello, Mr. Henderson. So I meet with you like every 6 months, and we have a conversation about your memory.
Yes.
How it might be or might not be affecting you.
Yeah.
But also how it can be affecting you as a couple.
Yeah.
In terms of your memory.
Yes.
So because I've not seen you for a while, can you just, Margaret, tell me how you've been physically in terms of sleeping, eating, looking after yourself?
I could sleep very, very well. Very well. Eat all right, don't I?
Yeah.
And I haven't been falling, no. I sometimes have a wobble,
Right.
but I've not been down on the ground.
No.
Yeah.
And then when I come out and meet with you, I can see that you look great. You're beautifully presented. So in terms of looking after yourself, you're doing all that yourself.
Yes. Yeah. Oh yeah.
So what I'm asking here is about activities of daily living. So washing, showering, eating, drinking, and just generally taking care of yourself.
Yeah, I don't need any help with any of that. No.
And that's
I'm
good, isn't
right.
it? Physically, you're getting out there, doing your routines. The language that I use is called activities of daily living, and you score high on activities of daily living. There isn't a score, but in terms of a quality of life, you're doing really well. Yeah. Can you tell me if you're still getting your memory tablet?
Yes, I am. Yeah. A morning and an evening.
Yeah.
Well, tea time. Yeah.
And you supervise that. You manage.
Yeah. I mean, Margaret will do it. It might be an odd time I'm back to just jig it, but as I said before, because I'm taking tablets as well, morning and evening, it fits in with the routine, as it happens, both of us.
Now.
Yeah. So
when I meet up with you, what I'm checking out is how you're coping as a couple. That I can see that you have a good quality of life. That you do need to keep engaging with the local community. You do need to keep engaging in your routines. You do need to keep engaging with your friends. And they're all good things that we want to try and maintain. When things do change, if like you've already said, Don, if it's a medical thing, yes, it's the starting point is a GP.
Yes.
And at the moment, it's yourselves. There's no formal care in place.
No.
If we do need practical help, I can support you with that, but usually it comes through social services.
Yes.
exactly.
How do you find that your wife's memory changes affects you, Don? Or?
They don't affect me a lot,
Okay.
except that I can probably trigger things off that Margaret might miss.
Yeah.
I couldn't give you an example straight
It's
away.
usually
but
appointments, isn't it?
Yeah,
Remembering appointments.
we're quite strict with that, with the calendar
Everything's
job.
on calendar.
Look at it every morning, you know, we have a
Yeah, we have to
routine
go.
with that.
Yeah.
So, but there are little things that I find sort of just help by
Yeah.
maybe jogging Margaret's memory, if you
Yeah.
like, and it will come back then,
Yeah.
you know, she'll know.
Yeah.
So in terms of getting out and about, are you still getting on with all your routines?
Yes, we go out most days, don't we?
Yeah.
As I say, we go out for lunch sometimes, or an evening meal sometimes, but not often that, because I don't like Donald driving in the dark.
Okay. Okay. So you've got each other to support each other. Do you have an extended support? If anything were to happen to you, Don, who would you call upon?
I think we have told you before about the daughter. We have Jill.
Just Jill, really.
Yeah, and obviously neighbour. We have a neighbour who we're very close to.
Very good, yeah.
Yeah.
And Jill's husband would help as well.
Yeah, I'm sure they would.
Yeah.
Yes, yeah.
He's enormous.
Yeah.
He's a big lad.
So as we get older, just all of our health changes, doesn't it? And nobody's life stays the same. And you're okay in your spirits. You're not getting down or depressed.
No, I get sad, and the only reason is because my daughters are in Australia.
Yeah. Margaret can never get over. She can never get over
And
that.
I won't get over it.
No. And that's a sadness, and you can see the reason.
Yeah.
But in terms of getting down just because you're fed up,
Oh no, I'm fed up.
you consider yourself a positive person, a coper.
Yeah,
Yes.
yes.
And
I
they're
do.
good qualities to have, aren't
Yeah,
they? They're good
yes,
qualities
they
to have.
are. Yeah.
How are you coping as a couple in terms of your mood or any frustrations, or how you interpret your memory affecting you?
Donald sometimes does say, "You've already told me,"
Yeah.
and that gets you sometimes if it happens a few times. You know, I think I don't remember saying it.
Okay.
Yeah,
And
which is what it's all
It
about,
is.
isn't it?
That's right,
Yeah.
Donna.
Yeah.
It is about
Yeah.
those, that short-term memories.
Yeah.
isn't
And
it?
it is. It's funny because you don't know you've said it.
No.
You know, it's
And what we have to learn to do, and I know it's hard, we have to learn to say,
accept that it is.
we do, and
Yeah.
just
Patient.
reply,
Yes,
to be
yeah.
patient.
Yes,
So,
that's right.
if somebody says, what day is it today? Oh, it's
Yeah.
Wednesday. And then half an hour, oh, what day is it
Yeah,
today?
yeah.
If somebody said, it's Wednesday.
But
Yes.
I've already told you.
Yeah, that's what.
Yeah, so
No,
it's hard, but
Yeah.
we have to
Yeah.
learn
It
to
is,
answer like
yeah.
it's
Do
the
it
first
like
time.
that, yes.
Otherwise, we leave the other person thinking, oh, they're always
Yeah.
snapping at me.
Yes, yes.
We've had a little conversation about the house in 21.
Yeah.
And that's something that if we consider doing, it's something that has to be done as a phone call, that I would do that. So at the moment you can advocate for each other, and you're very capable of advocating for yourself. So if you were unwell, you'd recognise that and you'd ring the GP. If you became unwell and needed to go into hospital, or you broke your arm or a rib, and it was only short term, I don't mean anything too serious.
No.
House in 21 would do a welfare check on your wife, but we'd have to register that first.
Yeah.
And then you've got a daughter that lives in Leeds, haven't you?
We have.
And you've got
Yeah.
friends.
Yes.
Friends.
Yeah.
I'd always say the starting point is with GPs.
GP,
They're always
obviously.
they have
Yes.
sort of, they're the gateway to everything.
Yeah. Coffee morning. We go every Wednesday with a couple over the road. They're very nice. There's nothing wrong. Totally different to Donald and I. Totally different. And she talks to me and she tells me all sorts. And she can remember names of everything.
Yes, it's amazing,
And then
yeah.
I try to talk to her and I can people's names have gone.
Is it people you would know?
Oh yeah.
Yeah.
I was talking about we've been to 2 funerals lately, and I was talking about that, and the names just wouldn't come at all.
And how do you deal with that? Do you just let the conversation move on, or do you look to Dom?
No, Dom's talking to her husband.
So you just let it go, dear. Yeah.
Do you let it go?
Yeah.
Yeah, I don't. She helps me a little bit sometimes, but I feel, you know, like patronising. I don't want to be like that,
Yeah.
you know.
Yeah.
And she's the one, I think, that makes me feel the worst of any, because she's done it. She's right old-fashioned, but she's done everything, been everywhere, and she can remember.
Okay.
She can remember years back
Yeah.
and what
Yeah.
people have said and things like
Yeah.
that. I think, God,
Yeah.
you know.
At review, with my conversation with my patient and carer, I'm asking questions that may inform risk. I'm seeking information regarding carer stress, and within all my interactions, the focus is always about the patient and having an understanding of dementia and the impact of change over time, offering support with an aim to maintain a good quality of life. At review, this is one of the main aims of what I'm seeking.